You film it?
Yeah.
Okay. So let's start.
Yeah.
Yes.
So here we are talking about the shoulder. And this is just a hold so that we can journey with the shoulder. This is not necessarily the treatment of all the separate elements. So considering that there's a primary mechanics that involves the glenohumeral joint, the actual shoulder joint, and secondary mechanics, which are probably more important than the primary ones, that are scapula and clavicle, I want to think about a hold that'll give us a chance to listen to it all. So I'm taking my hand, she's got her hand on her belly, side of her hip. I'm taking my hand, I'm pushing it palm down like we do when we go under the coccyx and double-ended rabbit hole. And I'm pushing down till I get under her arm, and I'm just turning it in place. So now this crook of my hand here is in her armpit. My fingers, you see, are wrapped around her humerus or arm, upper arm, and my thumb is kind of resting on the front part, the anterior part of the humerus. And then I'm leaning into my forearm, which creates a little bit of a lift, and I'm pushing down, and I'm sliding my hand directly under her scapula. So the tips of my fingers, or the palm pads of my fingers, are right on the medial margin of the scapula. So if you look, they're right here. If you can see that back there, they're overlapping the edge of the scapula. And then my thumb, we have one more element. We've got the shoulder joint itself, and then we have the scapula. And I'm taking my thenar eminence and my thumb, and I'm just kind of draping them over the top and kind of hooking my thumb around the clavicle here, about a third of the way medial from the AC joint. And then I'm going to lean into both forearms, which will create a lift. And I'm basically seeing once I do that, what is her shoulder? What is the complexity of the shoulder joint saying to me? This may not be the place from which you treat, although it's pretty cool. We've got the secondary chakra of the shoulder right in front of us. We've got the chakras of the AC joint and the SC joint right around us. But this may tell you where you need to go and which next procedure you want to apply. I've only given you a couple things to work with, and there's a bunch of them that we did in the counter-strain class. So I'm feeling relative to breath what happens to the clavicle, what happens to the scapula, and what happens to the arm into the shoulder. And I feel a distraction, a swelling phase, and a kind of internal rotation of the humerus. And with that, I feel a shearing of the clavicle laterally into the AC joint and a pulling out of the scapula. So I'm going to use my belly, and I'm going to create this lift and turn and strain, going into the pattern of distortion, shaking hands with the distortion.
A two-directional kind of pattern.
So it's three-dimensional, very three-dimensional.
But I mean, it's kind of different, and you're in different directions.
Yeah, that's it. So we're dealing with the whole shape of the shoulder. Do you see that? I've got the whole thing in my hand.
How's that feel, Lane?
Good. And it's exactly the pattern that would be caused if you're always sleeping on that side.
With a bed that's too hard and pillows that aren't high enough for you.
So you corrected your sleeping pattern.
Yeah, now I'm doing it to the other side.
Internally rotating. And how do you feel for the what do you do with the shear?
I'm shaking hands with the distortion. If it's shearing down, I'm taking it down.
Oh, shearing down, like shear you, like it's some part is pulling.
The clavicle's pulling down toward my left elbow.
Got it.
So the important thing is you've got at least three elements under your hands. You've got the scapula, the clavicle, and the humerus. There's nothing humorous about it. And then you have all the joints and structures that connect them. You got the chakras that are there. You've got the river of chi and the fiber optic cable moving through you, and lots of other stuff too, probably. And that's it. And we're watching. We're looking at the relationship of the shoulder structures to breath, and we're treating it basically. So once the vectors kind of disappear, and you want to think about what perfection looks like. Now, I have a limb bud under my hand, don't I? Right? And it connects with a bunch of nerves to the superficial investing fascia and those segments of it, right? And then I have these nerves that are connecting to the spinal cord and then connecting to lamina terminalis via that mechanism. And then I have midline of the extremity, which is like the axis around which the entire thing is organized. So I have 3 different sets of homing mechanisms working through the shoulder that would like to be juggled. Choose one. I would not, when you learn to juggle, you start with 1 ball, and then you do 2 balls. If I were to choose one, I would go with midline. And then build your perceptual field from midline. Midline and breath, right? That feels pretty good. Feel good to you? So from here, what I'm really aware that's not happening is clavicle's not resolving. Everything else is breathing. Clavicle does not have the resources to release to breath. So now I'd shift, go to the head of the table and start looking at clavicular procedures and stuff I can do to organize the clavicle. So at least you have a vehicle to make decisions. What those decisions are and how you act on them is not in the scope of what we're doing now.
God bless you, Larry.
I
Wait
think
till
what
the summer.
you have is when are you going back?
A Monday morning?
When?
I can't come in Monday. Office day.
It's always an office day.
Yeah, and then I'm moving right.
Maybe when we're done, I can take a peek at this.
Oh, yes. I've been doing everything else.
Because I think what's going on is your actual clavicle, your AC is unstable here and here. Probably here is driving this. This can't find its way back because the SC is off, and probably the bow tie and relationship to the base and all that stuff.
Just want to mention that I've never had a lift. So my shoulder lockdown, don't think it's only from weight bearing.
What?
Like when I had that clavicular